This video I'm going to talk about the pelvic girdle. Specifically, I'm going to discuss the os coxa or coxal bone, the hip bone. This is an articulated pelvis. So the two os coxa, the two hip bones, articulate posteriorly with the sacrum. Now I'm going to look at a disarticulated pelvis. You see here, this is a single hip bone. This is like you're looking at it from an anterior view. This is like you're looking at it from a posterior view. The hip bones, the coxal bones, are composed of, in an adult skeleton, 3 fused bones. You have this larger bone here, that's the ilium. Then you have this bone here that is the ischium. Let me turn it this way. This is the ischium. So this is from posterior view. This large superior bone, that is the ilium. Then we have the ischium here, and then this would be anterior. So if we look at an articulated pelvis, these two bones on either side, this is the pubis of the left coxal bone. This is the pubis of the right coxal bone that articulates here at the pubic symphysis. If we look at a single coxal bone, and this particular one is the left one, and I'll tell you how to distinguish left from right in just a minute. So again, that more superior bone is the ilium. The ilium, on the ilium, you need to know the iliac crest, which this ridge, this top ridge here, is the iliac crest, and then the iliac fossa is this sort of basin that would face inward. It would face towards the inside of the pelvis. So this is iliac fossa. Also on the ilium, you need to be able to identify the greater sciatic notch. So this is an anterior view. I like to look at it from a posterior view to see the greater sciatic notch. But here you can see the greater sciatic notch, and it comes to this point here. This point is on the ischium. This is the ischial spine, and just below, inferior to the ischial spine, is the lesser sciatic notch. Some other structures that you could say are shared between the ilium and the ischium. Here we have this large indention here. This is where the head of the femur would fit in. This is the acetabulum. So the head of the femur would articulate here, and then this large hole here is the obturator foramen, where you'd have blood vessels, some major blood vessels, and nerves would go through that obturator foramen. So on the ischium, you have the ischial spine, the lesser sciatic notch, and then you have this rough patch called the ischial tuberosity. The pubis is the more anterior bone, and so here it is not articulated, but pubic symphysis. Okay, quickly I'm going to tell you how to distinguish left and right in a pelvis that is not articulated. So in an os coxa that is not articulated, this one, what I like is to look at it from a posterior view. How do I know I'm looking at a posterior view? Well, I can see that greater sciatic notch, and there's nothing in front of it. If I turn it anteriorly, I can still see the greater sciatic notch back there, right here, but there's a bone in front of it. There's sort of some obstruction. So I know that I'm looking at a posterior view. So I've got the greater sciatic notch, and then I see this the acetabulum here. If the acetabulum is to the left of the greater sciatic notch, then I know that I'm looking at a left os coxa. Let's look at the other one here. This would be, so here I can see the greater sciatic notch. There's nothing in front of it. If I look at it anterior here, I can still see the greater sciatic notch, right? But there's something in front of it. So here I'm looking at it posteriorly. There's the acetabulum. The acetabulum is to the right of the greater sciatic notch. So I'm looking at a right coxal bone or os coxa.